It's an honor and privilege to introduce the guest of today. It is Dr. Faheez. He is a consultant colorectal surgeon and an expert in peritoneal surface malignancies. And is working with NHS and at Basingstoke, UK. Good evening, sir.
Evening.
Welcome. Welcome to MVR CanCon 2024.
Thank you.
Sir, how do you see what is the plan for a upcoming peritoneal surface malignancy program in India? What is the roadmap to it?
So I think we've seen over the last 10 years a huge interest and enthusiasm to provide this complex treatment for patients who historically didn't have any treatment options. They're very limited. And many of these patients were written off by those people looking after them, perhaps the medical oncologists.
Yes.
But over the last 10 years, we've seen a real progression and a move towards organizations such as the Indian Society of Peritoneal Surface Oncology, so organizing like-minded specialists across the country, training, and we've received a number of Indian fellows into the UK who then take learning from us and taking that expertise back to India, but also building a research platform within India itself, standardizing treatment protocols, and then making this treatment modality available to as many people as possible in India. So we've come a long way, but as Paul Sugarbaker says, there's a long way to go.
Right. I think because of all these efforts, we now have a registry for
Yeah.
peritoneal surface malignancies in India.
Yes.
See, the other question I would like to ask you is, does disseminated peritoneal disease in GI cancers, does that always mean it's a poor prognosis for the patient in the current scenarios?
Yeah, so I think it depends on the tumor type.
Okay.
But even then, we've had a lot of advances in systemic anti-cancer treatment as well, and our understanding of the biology of the molecular biology, mutational analysis, so we can target treatment much more effectively. So it's a combination, I think, of the best systemic treatment that's available with surgical techniques that allow us to remove disease, minimizing morbidity, so that patients can regain their quality of life quickly with the benefits of systemic anti-cancer treatment. So, yeah, to answer your question, I don't think it's necessarily a dismal process, and that there is a possibility to improve survival with an acceptable quality of life.
So it always depends on the biology of the tumor.
Yeah, I think so.
And we have moved way ahead from a palliative chemo to a curative treatment.
I think we have, yeah. So I mean, I'm always wary of the term palliative chemotherapy because what you're trying to do is prolong somebody's life with an acceptable quality of life. Are you going to cure them? Maybe not. But I think moving from this term palliation, which I think has some negative connotations, we're not looking to cure people, but some people can live for many years. And so you may argue that that is palliation, but actually, in essence, as our understanding of the biology of the disease improves, then I think we can push those boundaries even further.
So this year's theme is salvage, pushing boundaries for cure. So now we have moved from palliative chemo towards cytoreductive surgeries.
Yeah.
And now it's the era of small bowel transplant.
Yeah.
So how do you take it out when you combine the principles of both peritoneal surface malignancies, that is cytoreductive surgeries, extensive surgeries, along with the coming up of small bowel transplant, other transplant services? How do you see the future of peritoneal malignancies?
Well, I think the horizons are expanding now, aren't they? Whereas before we would see a red line if patients developed recurrent disease after cytoreductive surgery, or we couldn't achieve a complete cytoreduction, and that was it. But I think now it's becoming clear that working with our transplant colleagues, that actually we can go beyond that line. And so we're pushing, as I say, pushing that line further and further. And there, in selected patients, there are options for surgical treatment, which is of benefit. Again, it may not be curative, but we can prolong that survival even further than we did before.
I think Basingstoke is also doing a small bowel transplantation.
Yeah, so we've done, I think we've published our series of 15 patients. We've now done 17 patients who've had transplants,
Okay.
multivisceral and isolated small bowel, all for appendiceal tumours.
I think there's a message for MVR CanCon from the peritoneal surface malignancy side. In addition to cytoreductive surgery, we have newer avenues coming in the form of small bowel transplant as well as multivisceral transplants, which aims to improve the quality of life as well as improve the survival of these patients, which were usually termed palliative in the previous era. Thank you. Thank you, Dr. Faheez.
Thank you.
Thank you for that excellent talk.
You're very welcome. It's been a pleasure to be part of such
It was a pleasure. It was a pleasure hosting this.
Thank you.
Thank you.